First off, just tell us, how close are you in actually reaching an agreement with these workers to go back to work?
Thank you very much and good afternoon to viewers. I'm here in Cape Town to debate the Minister's speech, but I'm really concerned that the families of the bereaved have been inconvenienced, and I would like to send firstly my condolences to their loss, and secondly to assure them that we have spared no effort since last week to try and resolve the dispute from the officers that support forensic pathologists. And I've also instructed that the acting HOD must meet with all the representatives, which he did on Monday. And yesterday we had no choice, in the best interest of the public, whilst we resolve this matter, to request assistance from the military health services. And we are assured that the ops medical officers in the military health services would be joining us today as a department, as a forensic medical services, to ensure that we deal with the 200 forensic pathology backlogs that have to be done. I would also want to assure the public that the doctors who are the pathologists are available and ready to do work, and all our services, other services are open. And we will do everything possible to, over the next 2-3 days, to deal with the backlogs. Now, I'm also asking the public to phone first so that they are not inconvenienced in waiting at the various mortuaries. If they phone first, the mortuaries where their loved ones are, before they come, so that they can be assured that the postmortems have been done. MEC, I'm struggling to hear you, but I hope you can hear me. Of course, the question is regarding the bodies of people at mortuaries. We've heard horror stories from families saying that the wrong bodies have been sent to funerals and stuff like that. How are you going to make sure this doesn't happen again in the next couple of days? I unfortunately am not aware of that matter specifically. What we are dealing with now is the backlog that is there. We would remember that the cases that are with the forensic pathologist are those that have been sent by the South African Police Services, or in cases of investigation by NPA, but also for all unnatural deaths. And these are services to the justice system. And if families have any other concern other than the delays, I would really appreciate it if they raise it with us, so that we can investigate and take the necessary steps. But for now, we are happy that the military health services is going to assist us to deal with the backlogs whilst we resolve the concerns of our workers.
Can you just tell us what your workers are asking for, and how long have these talks been going on for?
I must say that this is a historic problem that arises from the moving of the service from SAPS to health. And some of the matters are at the National Bargaining Chamber. But what we could resolve immediately, and we hope that workers will take this positively, is that the counseling and debriefing services will be immediately be made available. Secondly, that we will relook at the remuneration structure, so that we can trace it back to when they were at the South African Police Services, because what they had agreed with the department in the past is the OSD, but it seems like many of them have reached a ceiling. So that matter is a matter that is at the National Bargaining Council. But from our side, what we can do, we are prepared and are ready to implement that. And the other important issue that they are saying is that what they do is not part of their scope of practice. The issue is that they've been doing this even when they were with the South African Police Services. What we have instituted as the Department of Health is that there is a course that they need to undertake so that we can do recognition of prior learning. We're still negotiating with institutions of higher learning to offer this course. So this is a matter that we are prepared to work with them on in terms of recognition of prior learning. But this is a service they've been doing for the past years from the time they were with the South African Police Services. And the officers assist forensic pathologists, and they specifically assist in the dissections before the forensic pathologists do the examinations.
And very quickly, I've run out of time, MEC. Of course, this has affected the religious rights of some people who have passed away, especially with Muslim people who have to bury their loved ones the next day, if possible, as soon as possible. Lots of complaints in that regard. What do you have to say to those families?
There are many families for cultural reasons. For instance, the African families, they have also timelines that they would want to have. The Jewish community, the Muslim community, some come from as far as Lesotho, from other provinces. I've met many families that shared with me the pain of the waiting, and some of them have already sent the hashes to come and collect the bodies and all that. And I can assure the public that we're sparing no effort to ensure that with the assistance of the military health services, we deal with all the backlogs. And this morning, Dr. Kinoshi, who is our acting HOD, has met with the doctors actually, and they are also committed to assist the public.
All right, thank you so much for your time. We do appreciate it. Gauteng Health MEC Gwen Ramokgopa joining us from our Cape Town studios.